Hello, good afternoon to you all. I'm talking to everybody who is seeing this video going to be transmitted around the globe on YouTube. I'm starting off my story, which how I came to Dr. Geeta. I'm working in Sultanate of Oman in the Royal Court Affairs. That's the government sector office. So I will begin. I will start from the beginning of my case, how it was. At the age of 18, while I was playing rugby in Sri Lanka in my college, it's called St. Anthony's College, Katugastota. So while I think everybody knows that while tackling and all that, how rugby is very tough and rough game it is. So somehow I was fallen down, thrown. Then the people came on top of me, and then I could not walk after that. Then taken me to the hospital. Then they found it that with the X-rays at that time, no MRIs and so on. With that X-ray, they found it that I had slip discs. It is actually worse. I think there are three lumbar area. Just after that, I could not move, and days when the days pass, I could not pass the urine as well as stool also. It is blocked fully. I think stool for 1 month. I think it did not pass. So then they catheterized me for urine, and they given me an enema once, twice, thrice. No, it did not work. And just after that, they have given something else, and they removed the stools and so on.
They gave you a urine bag, right?
Yeah, urine bag. I
Yeah.
two
They
two.
put
There were
catheter.
two. Yeah,
They
with the
put
catheter,
catheter.
they have given two bags. It is one comes to this, and next one overflowing there. I think just to control the infections and so on. I think
Okay.
that is for 3 months. I was in the hospital, and I
My
was
God.
on a inclined bed with the
Yeah.
tractions.
Yeah.
After that, after 3 months, I felt a little bit okay, but urine did not pass. When they removed that catheter, after that, I could not pass the urine. They put water here down below to pass that. At that time, it was bleeding. Right? Just after that, I was discharged. I could not walk. Actually, my brother carrying, and they put me in a car, and then carrying, because we are in a village. Slowly I started walking, but it was buckling it actually. To tell you that it's buckled my legs, and it was numbness was there, and the back pain was there. But doctor said that this is how it is, and next step was that to make surgeries. At that age, I did not, even my family members, they did not want to have any surgeries and so on. Somehow, slowly, I went for a small treatment of Ayurvedic and the indigenous medicines. In fact, that also not for a long time, maybe few weeks, but I didn't do continuously. After that, I became slightly okay because I was young at that time. So then we have given a lot of other the foods which made me out of sick. Slowly, I became okay. After that, I started walking a little bit, then running still impossible. After sometimes about 1 year's time, I was okay. So while I was, then I applied job. So then I did not study fully. Then halfway I through that, I went for a job. Just after that, after sometimes I found it again. I could not walk. Then they have given me many times, not only one time, 3 4 times I had the same sort of thing, but numbness I had, the radiation of pain was there on both the legs, and it changes to left to right, left to right. It was so painful actually that, and I want to tell you that in my the reproductive area, where that area sometimes it feel like burnt. The sensation of how when you burn from hot water, it feels like that, the one part straight away. And the back also, what do you call, buttocks area also, I had the same feeling. That was not gone. And again the numbness was there on the calf, and just below that, uh, anterior area of that leg was numb. So then somehow I was carrying with this, and I thought that was the permanent case because I'm not going for any surgeries and so on. Whenever I'm going to the doctor, they used to say that, all that allopathic doctors say only this is possibility is to go for a surgery operation. So I declined that many times, and then somehow I managed. So then I came over here at After
Two.
some time, at the age of 48, uh, I was actually helping another person lifting a huge table, which you cannot explain that. At that time, it was I felt like something stretched. After that, I could not walk. So then somehow again I had that urine problem slowly. Then it is not passing well, and then the pain of the legs were there, and then I was almost like bedridden. After all that, again after sometimes while I was resting little bit 1 or 2 days, it will okay. So then I was resting. In fact, my office boss, my head of the department, also helped me a lot to stay home and resting and all that. After that I became okay a little bit. Somehow I cannot walk. Somehow in between I met Dr. So then in the
You went to the hospital.
yeah, so then I went many times to the hospital. So they have taken MRIs, they have seen my case. Then I came to a team which is called Dr. Niraj and his team, and there was another team was called Dr. Sharma. Both the places I went, then Muscat Private Hospital I went, everywhere they say that this is the only way that you have to remove these three discs, and then you will be okay.
Removed by surgery, right?
Reverse surgery only.
Yeah.
There's no other system. So then I used to go to Dr. Niraj, asking every now and then which way I can get it done, this some treatment without surgeries. Everyone says there's no chance. Even in Sri Lanka, when I went to Sri Lanka, I specialized doctors I met, orthopedic as well as neurosurgeons. Both they say that the same story everywhere wherever I'm going. So then I was like discarded. After all that, myself I discarded. Then painfully I was living, and mentally also I was depressed a lot, I can say. uh, so then once I was about to go for a surgery, even my boss also said that finally, Bandara, you don't have any other way that you can do it only for this one. Okay, you carry on. At that time, 1 day or 2 days before, I met Dr. Geeta and the family with Dr. Niraj at the
Market.
Matra market, fish market. So I was crippling and walking. I'm like lame man with my two children. They were carrying that, and I was talking with the doctor Niraj. By the time this lady, I don't know who was he. So then she asked, "What happened to you? What's wrong with you?" So then I told the story, and Dr. Niraj also did not tell me anything about her. Why I was asking so many times, ask you can ask even Dr. Niraj, that I forcefully asked many times, if there is any other medicine, any other treatment, please let me know. Nothing happened. Somehow, I think maybe the God brought her in front of me. So she said that, okay, would you mind come and see me tomorrow? And day after tomorrow, somewhere like I had to go for a surgery. So then I came over here. Then she told me the whole story, how it works, what is acupuncture. I don't know, but I heard about that earlier. I have read about acupuncture, but I have always biased towards this side. But I'm not going for allopathic. Of course, you need that allopathic course. I'm not totally discarding that. Anyway, I'm totally on this side. Most my 90% of treatments or whatever I'm talking about, only the indigenous side. So then she told me about all these things, and I said that okay, I will come tomorrow. So I started coming over here to her, despite the fact that I could not walk and I didn't have car. Even that I was some of the friends sometimes dropping me, sometimes I'm coming in taxis and so on. With all these difficulties, she came over here. I came over here to see her, and then she treated me once, twice, thrice, and then 1 week, 2 weeks. Then I felt earlier I was not thinking that it's not going to be well. I'm not going to be very well off. Maybe okay, I will try. Like that, I had a doubt. In fact, somehow I continued. After about 3 weeks or so, then I'm okay. Now I could walk. Just after that, we made an
Protocol.
yeah, what do you call, the treatment so called, which she made me in plan, and she has given me a food. I want to tell you that kind hearted lady who gave me the food, she taught me a lot of things, how to walk, how to eat, what to eat, and all these things together. I became somewhat better. After that, we made a what do you call ECG,
MRI.
MRI again,
Yeah.
and see that that disc was earlier, it was blast off, like you can say that it was almost gone out of the area where it's supposed to be. And I could not believe that earlier MRIs we have seen that at that time we have taken two MRIs from my side. So, third one we have taken from the Kola again after the treatment of 1 month, I believe. Yes, it was like 1 month. That discs were back to normal, nearly normal, and I found slight protrusions because that experts are here, herself as well as Dr. Neeraj both had seen and say that it is almost okay. Yes, of course, you don't need to see that because that I'm walking, and I'm going for the work also very well. I'm actually my flat is fourth floor. Now I could walk. I can walk up down very easily without any difficulties. Then it went on for I think nearly 6 months. I cannot remember exactly. Maybe
Yeah,
less than one
6 to
year.
8 months.
Yeah, not 1 year in fact.
Yeah.
After that, I became really okay. My nerve systems, my then urine passing, all these things became normal, and
Dripping of urine.
yeah, that dripping of urine that became normal,
Yes.
and it is stopped fully, no more. Just after that,
The
I
numbness.
want to tell you that numbness
Yeah.
till the day age of 18 up to age of 48, I had the same thing. I thought it was the permanent fixed one which is I'm suffering, which became it is vanished. Now also it is vanished. There is nothing as such I could see because I feeling myself, and I'm not lifting now many things, but I could, but I'm not lifting anyway. Why should I take any risks in between? And my age is now this much. So when I'm
You're how much? How old are you now?
now 60 plus,
62, no?
yeah,
Yeah.
62. I'm
So
going to
that
be
means
62 now.
48 you came, it is 14 now, 14 years.
14 years, and
You are living a
there
good
is
life.
nothing to say about this treatment. This is something which I don't know how she is doing, which no MRI, no any other scanners can read me, but she found it that exact point and she is treating me. And I want to tell you one more thing, that she was on the toe down below. She pricked me with that needle. It was so painful where my back on that lumbar area started something
Feeling some alignments.
something alignment. It's like I cannot say what a pain I had
Because
from
that
there.
day I gave you a painful point,
Painful point.
which stimulates the back
It was
Yeah.
just after that I became the so-called uh, discs came back I
to
think
normal.
back to the normal.
Yes.
I can't imagine that moment. Still, I'm telling many of my friends also that what a pain, that anything happening to my leg, I'm thinking of that. What a pain on that. And here at the back, it's aligning,
Yes.
which became
That is like magic.
that is like a magic. And she's
Yeah.
having the golden hands, which we can say magic hands, magic wand. Maybe she is having. I don't know.
It is my dedication to the
It
work.
is because that she does with a very kind heart and very mindful. She's very mindful. That's why she's exact points, and she's talking about me and where to do that, what to do, and which way, where the pain, where's the numbness. All this she's first analyzed me. Every day is like that. Not only one day. In
Yes.
general, the doctors they say okay, not looking at the patient even, just write something and giving. Okay, you have to live with this. Even to tell you, one of the doctors here in here, I went specialized doctor in a government sector. He's the in the medical panel that selecting doctors. In that medical panel, he is the chief. He told me when I went to him, he told me, now I can't help, no one can help, you have to live with this pain. I said,
Yes.
do you want me to live with this pain until my death? Death imminent. We don't know, any moment it can happen, but should I? I could not believe.
That has come false,
That
That was,
false in the sense that it's this is in front of you
This-
all. I think you all thinking that I'm just sitting. No, see, I'm not sitting now. See, I can stand.
Yes.
Anything you want me to do?
Yeah.
Yes, I can
Maybe
do.
maybe you can show some
Yeah,
exercise.
I can show some exercises. I'll show you now. Where, despite the fact that I had all these sort of things, I will show you that this chair, I'll keep it here and I'll put my leg up easily. Can I?
Yes.
Yeah, okay.
Yes, please. Oh my God, good.
Okay.
Vandara, God
Okay.
blessed me. God
See?
blessed me today to see this.
See?
Yeah.
Okay.
Yeah,
Now,
thank you
what
so
happened?
much.
You did
I
the
will
squats.
remove the chair. Yeah.
You want me to do the
Yeah, yeah,
squats?
yeah, please.
See?
Yes.
See?
Yes, please.
Earlier, I
Yes.
could not move like that. Okay? I could
Yes.
not move like this.
Yes,
Squats and all that.
Vandara. Very nice.
Impossible. Like this,
Yes.
standing like this,
I'm
sitting on these squats.
I'm seeing you after so many years.
See?
Yes.
Okay?
Yes, yes, yes.
And then
Very
what?
nice.
This way.
Yes. Oh my God.
Okay?
Yeah.
Alright, this
Yeah.
way.
Yeah. No pain, no?
No pain, what pain? Okay?
Yeah. Yeah. Very nice. Very
Okay.
nice. Yes.
Now this one. This one, eh? I'm doing all these things.
Yes. Oh wow.
Okay.
Wow.
Alright?
Yes.
And this one.
Wow. Wow. Great. Great.
And this. I'll show you this. Okay?
You do split also?
Yeah. Split up to
Ooh.
this much.
But now you're wearing pant, no?
Huh?
This pant is okay?
Yeah.
This trouser is okay?
See?
Wow. Oh my God. Oh my God. Wow. Great.
It's me bandar.
Yes.
Okay, and
Yes.
Push-ups this way.
Yeah. Okay. Wow. Great. 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 Wow. Wow. Okay. Yes.
Then all that, okay, I can do that.
Yes.
Bending only this much.
Yes.
This way.
Yeah, you have to do slowly.
Yeah.
Yeah.
Only this much I can go. But if I do practice this,
You will go down
This.
also. Yes. Yes. Yes.
what else I can do?
Yeah.
You want me to do this?
Okay. Wow. I'm very thankful to you to heartfully show everything what you are able to do, and you're making me feel proud that
And
I
I'm not
have
doing all
had.
these things. I just to want, show you this. That day I show a
Yes.
little bit of this.
Yeah.
And to tell you that, if you want me to run fast,
You
run with the daughter. She is 18.
Yes.
I'm 62. Both together we run and show. I'm going to win. Surely I can do that.
Yes, Vandana.
So that means
God
I have
bless
to thank Dr. Geeta
Yes.
a lot, which she made me into this level uh, in Sri Lanka as well as over here. Nobody could help me in this way. She is having golden hands. It's, you can say, what you call magic hands. And I have never seen no one has, because nobody treated me in this way. And everybody says surgeries, 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 which of course you have to go some cases, not everything, for not every aspect of diseases. But this one accidental, because I met with an accident. Then after that I had, of course I forgot to tell you that I met with an
Second time you met an accident. Yes,
and then I see
Yeah.
after your treatment, bus knocked me down in Colombo.
Yeah, I know your car was broken.
Yeah.
You came to me with broken car.
Broken car also, remember?
Yeah, yeah.
So many accidents happened,
yeah.
but still I'm very strong because of your
Yeah.
treatment.
Because of treatment, you
If you
became so
not-
strong that
Yes.
day. I was afraid your back must have gone back.
Gone back.
But no, you told me nothing happened on your back.
No, nothing.
Yeah, I remember now. Yes, but
was a
you
big
had
accident, in fact.
something on the neck,
Yeah, on
no?
the neck.
On the
Yeah,
neck you
on the
felt
neck I had,
something.
yes.
Yeah, but we treated, no? Later?
No, we
No?
didn't get a chance to treat
Do.
that.
But you got healed yourself.
Heal myself, but still I have a bit of thing, while turning this way and the other side.
Okay.
Slightly, sometimes I have,
Okay.
but some treatments in the oil treatment I did bit of that.
Okay.
That's all.
So your body was fit and fine to recover quickly from
Yeah,
that. Huh?
yeah.
That means the internal power had increased.
Yes, and what you have done, I think I
Increased.
remember you made me my system working.
Yes,
First thing is that
better to heal itself.
heal itself.
Yeah, the inner healing power
Inner
was
healing
increased.
power. You made all the
Was
energies of
improved.
the
Yes,
organs.
yes,
Made
yes,
it powerful.
yes.
So I think this recovered a lot of the areas where you
Yeah.
are. It is tailor-made treatment. I can tell you that you made to
Thank
me.
you so
It's a
much.
specialized something
Thank
which
you
I
so
don't have
much.
done for any other people or not.
Yes, thank you so
This is
much.
I'm really happy. I'm telling you that I'm telling you this word I had to say. She is my God. She made me in this level. Otherwise, I would have gone by now. I don't think bedridden. There's nothing more than that I can say, because I was before coming to you. I was very much on the floor sleeping. Even I'm crawling to the washroom. I could not sit on a chair. I could not stand up even. Somehow after a lot of resting or 1 month, yeah, 1 month or one time I was resting. All the people they used to give me food and all that. Somehow I became slightly okay. That time only I came to you, and in fact they dropped me down to some of my friends. They used to drop me down to Matra.
Yeah,
Then they are taking to me back home.
yeah.
It was a tough time, which made me very simple. After that, a very simple life I'm leading now, without any difficulties.
How old do you feel now of yourself?
I feel like her age.
18 years old.
Oh yes.
Oh my God.
So you made me my mentally. You made me. First of all, I have to tell you that you made my mental satisfaction up. Yeah, the
Yes.
positive mind you made me.
Your mental state.
Yeah, mental state with the positiveness of that is
Yes.
gone for I think about almost 100%.
Because I always gave you will come out of it.
Yes,
You will
out
come
of
out
it,
of it. You don't have to live with it. Anybody can become normal.
What happened was that doctor told me, that you have to live with this one.
Yeah, that is
So
the
I
negativity.
felt, what is this? And I got angry. I was really what to do after all this.
Because he don't have the systems to help.
Systems. But
don't have
this
the
is not the way that. Sorry that any doctors if see this, any other Western type of doctors treatment which are under what you call allopathic, they should not say that you are going to live with this or any other diseases also. You have to
Yes.
say that there are so many other ways in this
Yes.
world.
God has blessed us with
Blessed
healing
us with
systems.
so many things.
Yes.
So many. There are blooming up a lot of other systems on
Yes.
this earth.
Yes.
Right.
Yes.
What you do is like that new researchers and all that coming up. Same way that so many other our naturopathy natural systems are coming up, which you have to help them. If you cannot do that, you must direct them to the other divisions
Yes.
to make everybody happy. So then peaceful mind everybody. So I'm very peacefully I'm living now. I don't have, I think really I can in fact I was doing martial arts long ago. I think I could practice that also now, but I'm not going to lift so much. Slowly, I have to do all these things.
Yes.
In fact, there are no time actually for me to do most of the time when I'm in the office. There are no times are limited for me to do relaxations and so on. Anyway, she told me even that breathing exercise also she told me to do. She has taken me to Ayurvedic, one of the Ayurvedic doctors here, hospital also here to get some treatment, which some medicines I believe. Yeah,
Yes.
some medicines.
Some
Remember?
oils for the nerves.
Yeah, oils for the nerves.
Yeah.
She taken me to that area also. That such kind of doctors, I don't think you will find the kindness of this lady doctor. She is blessed. In fact, to the earth, she should live longer and longer and longer to treat whole world, the people, even that children, that disabled children, you will find with Down syndrome and so on. You might see other videos which they made in front of me. Like so many others, remember at that time so many what do you call patients came here to me. Even my bosses and so many other friends, they used to come over here for treatment and they got treated very well and they are well off everyone. I met some of the people daily. They are walking up and down without what do you call elevators and so on. They are walking up 3 floors without any difficulties for other diseases, not the spinal trouble. So many other varieties. I think that in the world, with this treatment you can do everything, because
Yes, that is very true.
that is very
Except
true.
an accident,
Yeah,
quickly an
the cut,
accident, we cuts.
bleeding and so on. It is
Bleeding I
hospital,
don't handle, and childbirth I don't handle.
childbirth, yeah.
But rest, pregnancy, in pregnancy,
And,
all asthma in pregnancy, blood pressure in
and that,
pregnancy,
hormone,
everything. Yes, hormone
imbalances.
imbalances. You saw that case,
Yeah,
no?
yeah, I saw that.
Hormone
I saw that lady,
imbalances,
yeah,
where
yeah.
doctors told her
that-
she will not produce children. Today she is blessed with 3 children.
And that travel agency girl who was working in the travel agency.
Yeah, that
remember?
is Alka. Alka, she has 1 kid now.
Yeah, you see that.
Yeah, doctor said no. She will not conceive.
To tell you that, frankly, I wanted to tell you this. If any doctor or anybody just seeing superficially anything, if you see, it is wrong. You have to go deep into the bottom
Systems.
of the well. You could see something, and you wait. You don't get agitated yourself, so then you cannot see. That is like a mud, what do you call, well. If you want to see the bottom, you have to wait for some times. So you see the bottom.
Because when water is clear.
Yeah, when water is clear. The same way you apply and you give it to time, you know that you cannot do, and there are in the bottom there are people to do that. So all the levels are there are so many other treatments in the world. So don't discard people and don't depress the people while talking. Say that okay, this is what you can do. This is nothing. There are no treatments. This is the only way that you could live on this earth until death. Who is going to suffer like that? At least
It's all in God's hands.
God's hands.
Man cannot decide
No, we
that
cannot
you
decide
cannot get cured. Even when a patient comes to me, I don't tell them that I will cure you. I tell them only if God wish, then God will cure. So, Bandara, I would say I am also very thankful to you. You made me see my God through you.
Through me,
Yes,
yes. Yeah,
because
that
you tried to understand. You read everything carefully. What I gave you instructions.
Instructions.
You followed
I
my
followed
instructions.
very well.
And then you followed everything, and you followed the treatments. You believed in me, and that's what took you out, and that's what gave me 50. I walked 50% to you, and you walked 50% to me. Because of that, we could make 100.
Yes.
Where the treatment effect started, and you showed me the way how God comes on earth and heals people.
And I want to tell you one more thing about this one. When the Dr. Geeta or any other acupuncturist, any other acupuncture doctors, naturopathy doctors, when they treat you, if you don't get what you call cured quickly or whatever, you need the time. It depends on the body to body. It differs. And again,
very
I
good.
want to tell you that
Very good.
she does herself maximum 1-to-1. But myself, if I'm not following that 1-to-1 and say that no, that is bullshit, I cannot, I don't want her to go and see this, I don't want her to follow the treatment. Yourself is not even the 10% into this
Contribution.
contribution. So then how come you can make it? You yourself keep
At least
confident.
give me 50%
You
contribution.
have to totally follow. You have to obey.
Yeah.
Obey to her. Follow the treatment. Come the time, a specific time she has given. Come. Don't delay. The next patient comes. So maybe you have to skip the day. So then you will be losing 1 day. Your improvement, which is coming that way, and then it is drops down. By the time next treatment comes, then again you have to level it up.
Yes.
So when you come to the
very good.
how are you going to
You remember everything after so many
so
years.
then you are going to every day you have to top up up to the 100%. Okay, not 100%. Sometimes depend on the age, depend on your body system.
Yes.
That the 5 fingers are not the same. Everybody is differ from the other person. So then we have some changes. It's different case, but not 100%. You don't keep yourself, but you have to give contribution towards this 100%.
Yes.
Then you will see the results like mine, which you have seen now to your eyes. You cannot say that there are no fake videos here. I myself in front of your camera.
Yes.
This is
You
there
saw
are,
you saw a case of Down syndrome now,
Down
no?
syndrome
Yes.
case I saw.
She's
And again,
walking,
and
talking
there are no
in another
generated
video.
pictures. There are no generated pictures. No graphically enhanced anything. This is the same that natural shot what you are taking of mine to show you that this is how Bandara is now.
You can talk. I will give your number in this video so that if anybody want to talk to you,
Yeah,
you can talk.
please
Yeah,
do
yeah.
contact me by any chance if you want more to know that my experiences, how I was, and while treating, that was, you cannot imagine. I think that there are no words to say about. I don't find that any vocabulary in English or Sinhala or in my language or Hindi or something like that. The feelings, there are no words, which few limited words only all these languages have, where the so-called feeling of my that mental
Divine
satisfaction,
feeling.
divine feeling and satisfaction of myself,
Yes.
day by day it is getting up, that I was like, that I thought I don't wanted to live in so earth with this such a pain. I could not walk, I could not move, I can't go for a loo, I can't go for a, when I get a call of nature I cannot go.
Yeah.
What is this? Any moment, and then again maybe I have to carry always urine bags with me all the time.
Yeah.
This is how it was.
I'm blessed to hear this.
So then, please do follow this kind of treatments, and the whole world people should open their eyes, and the other doctors as well as everyone should open, and even that acupuncture doctors also, they should treat like the way that she does. I have
Thank
to
you
tell
so
that,
much.
yeah.
Thank you
Reason
so
is
much.
that the kind heart comes first.
Yes.
That made you everything. That even that when you punch that with the needle from your heart, that goes that
Yes.
energy.
Yes.
That energy makes me more
It's
important.
written in the acupuncture book of Anton J. Surya.
Which I
that
don't know
it
about
is-
that, but
yeah,
I'm telling you,
it
this,
is-
this has to go
it is
into that.
not the needle, but it is
No.
the man behind the needle which works.
Exactly.
Yeah,
That-
it's very important.
Yeah.
Okay, thank you, Vandara.
thank you so
Thank
much.
you so much. Such a long video you have made for me. I know you are ready to talk 3 days, 4 days on this. Yeah, but
because about my case, if I'm going to tell you that
Yeah.
I think it takes years and years to tell about the
To
whole
describe
story.
what happened.
Every day it is I'm finding
one
something
story.
different, one story. Every
yes,
day one story.
every day was a story. Every day was one story.
Yeah, I think
We will make more videos.
of course this is
Vandara, you can,
not to advertise. This is not advertisement or
yeah.
something. This is a genuine
This is to
case.
tell the people who are really feeling. Many people don't know that they can be
No.
they can get cured like you.
No, nobody
They don't
knows.
know. They think
First,
their life is finished.
people don't know, first of all, what is acupuncture.
Yeah.
And they don't know about this much effect is there from this sort of treatment.
Yes.
And acupuncture, they think that okay, they are just punching everywhere and go, that's it.
Because they don't explain.
And the doctor should explain the patient, convince the patient, and make positive
Attitude.
of in that person whoever comes here, and his mental status must be very much high. She's made me that mentally very high, first of all.
Uprising your mind.
Uprising. She, even that way of eating, she made me and given me this food you eat. These things she told me something. I was following religiously. I was following what she says, and daily I'm coming over here until she says no. But in between, maybe 1 or 2 days, it's my fault. I think if I come late also, just because of due to my office hours. Sometimes I was delayed, but somehow I managed to made it to this level. I think now everyone convinced, I think, with this video that what is acupuncture and how it works, and what benefits after all that, after the treatment you get.
Unbelievable.
Yeah, unbelievable. It is an unbelievable hands behind this camera also, you can say that.
Thank you.
Which the golden hands I used to call
Thank you. It's all from the God.
Yeah,
It's
which-
all you made me feel so proud, and I must say that what all you told about me also goes to you
Yeah.
from me.
Yeah,
I
thank you so much.
respect you. You are my patient. You came forward to show me that what I can do.
Yes.
If you have followed it, that's why today I am feeling proud.
Yeah.
So this is what I feel.
Yeah.
Thank you so much,
So this
Bandara.
energy should go around the globe.
Yeah, thank
And
you so much.
people to
Yeah.
understand.
If before I leave this earth, I could do this,
Yes.
what you are saying,
Yeah.
this is my dream.
Yeah, this
Yeah.
dream come true any moment. I mean, every now and then, this dream come true, and it spreads around the globe to everybody to be peacefully live on this earth.
Yes.
It's no religion, no bar for
So
anything.
great.
Anyone can come over here. We think of only the human aspect of qualities only. So then she is, I think, superhuman lady doctor, which made me, not only me, she made lots of people. I think she doesn't have many contacts. I think
All
numbers
royal
and all
people
that
also, like Director General of Oman Environment, and
that
His
development-
Majesty's pilots,
Pilots, and
His
then,
Majesty's quantity surveyor.
yeah.
You know Ranjit
Yeah,
Udwawala?
Ranjit Udwawala.
Yes, I treated him
I
for
treated him,
discs.
eh?
Yes, for 7-8 discs prolapse. He was able to write and sign after
yeah,
His
yeah,
Majesty's
yeah, yeah,
papers.
yeah,
Yes,
he was
yes.
the-
I have that
Ranjit
paper
Udwawala,
also,
yeah, he
but
was working
I may not meet him to take a
Yeah, he's
video
in
because
Sri
he is gone from
Yeah,
here.
he's Sri Lanka, and I think he's in UK or
So many
somewhere.
cases, multiple disc prolapse.
And
And many doctors he visited. Nobody could do anything.
and what do you call that, PDO, the Petroleum Development Oman, one lady who came here. I
That
remember,
Shekha was having continuous throat problem. She was not able to eat anything. Everything is gone. She started eating. She started becoming normal.
Yeah.
That was also a very big case. She had stomach upsets and throat was always red,
Right.
which immediately changed the color. I don't know how this medicine which I am doing works. I wouldn't say I am an expert in this, but whatever I work with my heart and with the small technique of this medicine. By understanding, I put myself so hard in this to dig out the points for my
Yeah.
particular patient and try to understand myself. But how much I understand, God always rewards me with that, and that's how, Bandara, you are standing in front
and
of
again,
me.
to tell you one more thing, that you are go deep into the patient's every nook and corner, and she understands how the patient is. Now I'm having only this problems, but she know due to that what are the other difficulties he is suffering from.
Yes.
So she analyzes everything,
Yeah.
and in accordance with that only she is treating. So then every point she knows that where to treat.
Yeah, because with one disc prolapse, you will have urinary problem, your reproductive problems, and you will have other local problems, local muscle problems, many leg problems.
Yeah.
So if I treat you, if I concentrate only on the back, cut off your disc like doctors, what about the other organs?
Other
So
organs.
that's why I have to concentrate that I have to treat and look after all the related organs and tissues to come back to normal. That's why we call this medicine as holistic medicine.
Holistic medicine.
Yeah,
Yes,
holistic
it is-
medicine is you're treating the whole human being. You're not dividing and ruling.
No,
The
no,
allopathic medicine divides and rules.
Yes,
That's why they take heart for one doctor,
One doctor.
brain for one doctor, and kidney for one doctor, and other parts for different doctors. Every one doctor when treat for heart, he is harming the kidney. But when they're treating the kidney, he is harming the heart. So we don't do that. When we are we're treating all the organs in a cycle according to 5 elements, so that every part, even if the patient doesn't tell me other problems,
It
sometimes
automatically get cured.
automatically patient tell me after 1-2 months that I'm getting healed of other problems
Other
also, which
problems.
I did not tell you.
Yeah.
So okay, thank you,
Yeah,
Bandara.
thank you so
Okay,
much.
thank you so
Thank you so
much.
much again,
Thank you
doctor.
so-
I think
thank
you
you
live
so
longer
much.
for
Yeah.
treating the whole world of these innocent people.
Yeah.
And
Thank
God
you
bless
so
you.
much.
And the
God bless
blessing-
you
yeah,
too.
blessings
God bless
of
you too.
triple gem of Lord Buddha too.
Thank you, Bandara. Thank you, Bandara. God bless you to live more health.